This time I'd like to call the April 16th, 2025 meeting of the Board of Health to order. Jenny, could you do roll call for us?
Dr. Harvey?
Here.
Dr. Hayes?
Here.
Dr. Lindemann? Here. Mr. Lynn?
Here.
Ms. Rylander?
Here.
Ms. Van der Rainey?
Here.
Ms. Vincent?
All right, thank you. We have a quorum. Adoption of the agenda is our next item. So everybody has a copy of the draft agenda in front of you. At this time, I entertain a motion.
I will move to adopt the agenda.
Second.
Motion and second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Next item on the agenda is the approval of the minutes from our March 19, 2025 regular meeting. Hopefully everybody's had a chance to review those, and when you're ready, I'll entertain a motion.
I move to approve the agenda. No, that's what
Minutes.
The
Minutes.
minutes. Sorry, I apologize.
It's all right.
I move to approve the minutes from the meeting of March 19th. Second.
We have a motion and a second. Any further discussion on the minutes? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, board president announcements. I have no announcements today, so you're all welcome. Next item on the agenda, health officer presentation and report. Item 2516, discussion and vote on the health officer's report for the first quarter. Dr. Migliori.
I believe you all received the health officer's report in your packet this week. There aren't any major changes. I will point out that Amy, who will discuss this further, our Director of Finance, is trying to streamline the different funds. So as funds are sunsetting and we're using them up, they'll go away and it'll just make her bookkeeping much easier. And you'll notice that like the Vector Fund was zeroed out and we're transferring that over to the HFI. So you'll see that in a couple of areas. And we had some changes at the end of March with the cancellation of the COVID-19 grant money. We had that money went to two areas. One were our CHWs, and the other one was our immunization program. And so thanks to our board attorney, to our Director of Finance, to Dr. Purushottam, and mostly to Amy of quickly helping to set up a meeting with our auditor, John Murphy and Abby Doyle, and they helped us figure out how to move money around that we had so that we could, in a budget-neutral fashion, get everybody paid and keep everybody employed and doing the good work that they have been doing, continuing to do so. But that was accomplished, and Amy can talk about that more if you have questions.
Okay.
Do you have questions about anything else?
I had a few questions about a couple of the different programs. First of all, I think this would be for Matt Gotch. The total reach, unique people who've seen the post, is pretty impressive, almost 260,000. But I'm curious, are there certain groups, like locally, that are regularly reposting? Do like some of the things that you post on social media, like health systems and sorry, I have a scratchy throat. Or other community groups? I was just curious that what other entities are really passing on the information that you're putting out there. Oh, okay. I was just wondering the total reach, and again, I'm not that don't understand social media as well as other people do, but are there certain groups like health systems or other government agencies, anything that are regularly reposting the health department? Like who is really taking and kind of passing on the information that you're initially putting out?
I'd say for the most part, it's actually community
members who are seeing our posts and reposting it, whether it's for a vaccine clinic or one of our initiatives. Since we're partnering with the libraries for the Radon program, the St. Joe County Public Library and the Penn Harris Madison and Penn Township library system has been reposting those as well for that specific program, since we're obviously, people can pick up the radon kits from their any of their branches. But a lot of times it's actually people who are seeing our posts, just community members, and reposting it.
Oh, great.
And then I do have a way to break that down. So content interactions, I know you guys have that little that little graph there. So total reach would be the number of unique users who are seeing them. Total views there at the end would be views in general. So it could be the same people who are also included in the reach seeing things multiple times, which would then count for the total views.
Okay.
And then the total post engagements or content interactions would be anytime somebody likes or reacts to our content, either shares it, comments on it, saves it, or replies to somebody else or comments on it to us. And so I know 853 of the 3,472 content interactions for last month were shares. One of our posts got a little bit of attention.
Oh,
Happens.
okay. Am I supposed to know which one?
You can ask, it's fine.
That was the measles repost, because there was a case of measles in Michigan that we had said that there was just be on the lookout.
Okay,
And that one got a little bit of attention.
got it. Where in Michigan? Just
Macomb County, Michigan.
Oh, okay.
All right.
Okay.
Any other questions for Dr. Migliori or Matt?
Well, I actually had just a couple other questions, if that's all right. So I noticed so it's on page 11. I know that we talked about, part of HFI was, I think this is part of what we started with HFI, but chronic disease education classes. I wanted to know a little bit more about how the classes are going, and also where they're being held, and are they like a series, or are they kind of one-off classes on different topics?
Renata Williams, Director of Care Unit. So the chronic disease education classes are taught by our health promotion specialists. So when we were receiving the HFI funds, we decided to focus on nutrition / obesity with exercise, diabetes, hypertension. So those were kind of like our big three. She developed education presentations to teach in conjunction with both of the doctors reviewing as they were being developed. Also endocrinologist helped with the diabetes one. But she has been teaching them in partnership with some of the locations at Real Services. So they will invite her to several locations that they have around St. Joe County. And I actually wrote that down because I thought somebody might ask. So some of the North Liberty, Walkerton, Osceola, so some of the outlying counties. Also some assisted living facilities, health fairs. One Roof has been a big one. There are pre and post questions too for the classes. So it may ask, how well do you know what hypertension or diabetes is? And then post is the same type of question, 1 through 10, with the intent that that score is going to increase in the post. We also have like a qualitative feedback where they can type in also and ask like what are some of the things you're going to do differently now that you have gained this information and education. Reading the nutrition labels is a big one, making sure that they understand if you are diagnosed with a chronic condition, how important it is to adhere to your provider's recommendation, how that can lead to other issues. And so a lot of them say that yes, they're going to read nutrition labels, yes, they will be better about their diet, yes, they will have more exercise.
Thanks. maybe I can, it's a little, one of the other things I was wondering about, another program you started with about the MIH CHW's program where you're doing home visiting now. Are you the, should I ask you about
Yeah.
that? Or
Yes.
okay, can you tell us how that's working, and are you partnering with any health systems?
The IDOH also asked us that same question.
Uh-huh.
So this was, I'll have to say, we did a lot of brainstorming. MIH came underneath CARES umbrella April 1st of last year, before it was HOPE. So we have really grown in that time. Initially, it was 2 CHWs rotating through the Women's Care Center, which we still did that. We expanded to home visiting with 1 CHW and a half, because the Spanish-speaking one also is cross-trained from our CHW program.
Okay.
And then we started Ember with the education classes and the support group. But we consulted with Vanderburgh County. They have an awesome 3 to 3 MIH program or MCH program
In their county health
in their
department.
county.
Okay.
So we talked to them a lot when we were trying to build up just outside of Women's Care Center what we would like to do. And they have a home visiting program. It's very extensive. But they use the Growing Great Kids curriculum at their home visit. We applied for a grant to kind of mirror what they're doing. We didn't get that grant. It was a federal grant. In hindsight, I think that was a good thing. But we tried to see what we can do with the resources that we had. So we took pieces of their program. We used at home visiting, which is really about connecting with the baby, giving resources to the parent, making sure they understand, and then coupling that what we already know is going well in our MIH program, and that is breastfeeding support, observing the safe sleep environment, seeing if there's any other social needs or other agencies that they need to connect to. It was kind of slow starting off because we really had to build that relationship. Letting someone come into their home was not, they're kind of like, yeah, I would be interested. But over time, we have grown in that capacity. So every month they're doing their visits. We built a new platform in REDCap. So we changed our MIH platform to be able to also document what's going on at the home visits, what they're asking for, that we're doing safe sleep education, providing additional support, nutrition, checking on mom, making sure she's going to her appointments, that the baby is up to date for their immunizations, asking any other questions.
And so how do you decide, or how is it decided who is part of this program?
Okay, so it's an extension of the Women's Care Center. So one thing we identified with the evaluation was like, Women's Care Center CHWs are basically stationed there to be able to receive new women. But through that relationship, we really expanded. Previously, there was a lot of focus on insurance navigation and then the provider for the prenatal care for the appointment. We really wanted to push more once we had staff stabilized, the resource navigation part. Is there anything else we can do? What else can we connect you to? And as we followed the women more closely, the insurance navigation, the provider referral, but continuing to reach out to them and check up every month, we developed that closer relationship. So at the end of the 9 months after they deliver and we get the birth information, we ask them, are you interested in our home visiting program? Do a warm handoff to the CHW who would then do the
Oh, great. Very good. Thank you for doing all of that.
And their Ember program is still growing. It's passing, I think, most expectations.
Yes.
They've done an incredible job.
So you're on your are you in the midst of your second kind of series, or?
We're about to. May 1st, the beginning of May, will be the next quarter, although it's off because we started in February. But yeah, so the first 13 set of classes will be done at the end of April. We'll start over. So far we have already saw 51 unique women, I believe it is. We also have been getting requests from other organizations to come teach. We don't do the whole 13. We kind of will pick and choose and let them know what we have available, and we'll go teach there. Women's Care Center is one. We plan to also teach safe sleep there. They do touch on and give some information, but a more in-depth, because we also want to provide the education also to anyone who's helping support the mom. There's a lot of misinformation. Oh, I did this when I had my baby and they were just fine. And we want to make sure that they have the most accurate and up-to-date information.
Okay. So you're also going to like Women's Care Center, but other and other places that would focus on programs for moms and babies,
Mhm.
and you're providing like one-off classes
Yeah,
on
yeah.
special topics.
Yeah. There was
Okay.
a church also that reached out and they said that they have a group of women that meet that's in their third trimester. So we are growing by leaps and bounds, but I'm telling the team to be careful because we only have so much capacity with what we have. And, you know, some of the education, the classes and the support group are off hours, and I don't want them to get worked out. I know everybody's passionate, but we gotta make sure.
Mm-hmm. Yeah, that's a balance.
Mhm.
Thank you.
Yes.
Thank you. Very, very helpful. Any other questions for Renata or Dr. McLeary or anybody else? Thanks.
CHWs are being trained on blood pressures too, so that when they're out and about, we can record those blood pressures and give people little cards with the guidelines for what are, you know, green, yellow, and red
Mhm.
numbers for them to have, and just raising awareness. So
All CHWs?
that
or-
we've started training the CHWs.
Oh,
yes.
okay, so like the community ones and the maternal health ones, and maybe even the lead ones. Okay.
Knowledge is power.
Any update on the food code? I haven't followed it at the county
Oh,
level.
poor Carolyn.
Oh.
Not here. Basically, it came into law technically, but they haven't fully ratified the new code. The old code went out of law, let's put it that way, and the new code is still being rolled out.
As far as the county's updates to our code, did that pass?
We're going
or-
to do a slow, yes, it has been updated within the county, but it's going to be a slow rollout during this transition phase.
Did the county council
Yes.
pass it?
They passed it.
Okay, great. Good job. Any other questions? If not, I'll entertain a motion to approve the health officer's report.
I will move to approve.
Second?
We have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Next item on the agenda, new business, item 2517, discussion and vote, budget, local public health services. Oh, did I skip I'm sorry, I skipped the spotlight.
It's okay, it's me.
Can we do the spotlight now?
Yes.
I'm sorry.
Do you mind doing the spotlight now? Are you guys ready from the slide standpoint? Okay.
You want to go on to the next item
Yeah,
then?
why don't we do the new business,
Okay.
and then we'll come back once they're ready.
No worries.
So with the loss of the CDC grant, as well as the immunization grant, we are offloading those staff to HFI. With the CDC staff, we knew that grant was ending. It was originally supposed to end August of this year. So we already had that staffing and those programming costs wrapped into HFI. So they're set to go. Immunization program, that was a shock. We were not prepared for that to happen, and that's what this request is asking for. The top portion of the request, and this was laid out, this is how the auditor, John Murphy, asked for this to be laid out. He wanted the top portion to be, what do we need HFI to fund? So that's going to be the personnel, as of, I believe it was March 25th, and that'll take it to the end of this calendar year. And then the bottom portion is what money are we having to remove from the immunization grant because it's no longer available for us to use. We did receive notice about a week after the news that we were being, the funds were being eliminated, that we do get to keep around $83,000 because those were not COVID funds. So that has been taken into account into this budget reduction and appropriation. So it's, to recap, it's to fund our immunization staff from now until the end of the calendar year.
So just to be clear, when you say that 83,000 we can keep because they're not COVID funds, is that a portion of the state grant that wasn't federal money being pushed through? Or was it like the portion that didn't relate to actual
Correct,
COVID?
correct. It did, when we received that notice, they had 4 lines of expenditures that made up for the 24 and 25 year. We received around $636,000 for the immunization grant, and it came from like 4 different federal grants.
Okay.
So once they removed what we used and what was unused, how much of that was COVID that was left, and that's what we lost. I believe that's around $199,000 is what was lost from the immunization grant,
Okay.
because it was COVID related,
Okay.
and we get to keep the $83,841 since it was not labeled COVID, because the immunization grant, we had that starting back in 2015. We
Okay.
had it for 5 years before the pandemic hit, so
Uh-huh.
there were non-COVID funds available for the immunization program. They're just removing what was tied to COVID.
Okay, so kind of, so basically, the portion of the funds that was not used and targeted for COVID-related things, be like, I'm trying to, I don't know what we even spend it on, exactly, is it supplies and,
I think my explanation to you was totally off.
What was the question?
oh, no, I'm just, so, just, I don't even remember what we, in this health immunization grant, what we're spending the money on, I have to look
If
back.
anything tied to the immunization clinic, any supplies,
Okay,
it does fund the staff, all staff except our MA in our South Bend office, as well as the 2 registrars, the full-time registrars, and the vaccines are not covered under this grant. They do not allow vaccine purchase using these funds, but anything else related to immunizations, whether it be our EMR system, supplies that need to be purchased, the personnel for the other staff, that all was funded through this grant.
okay, so whatever the state or whoever determined is being used for like school vaccines and stuff, needles and alcohol wipes, whatever we're spending it on, that we got that portion back.
I don't think that's how they did it. I think they just looked at how much money was available,
Uh-huh.
you know, as of March 25th, how
Okay.
much has already been expended, you know, wipe those out.
Uh-huh.
What's left that's tied to COVID,
Okay,
remove that amount, and then the balance of what our grant was minus our expenditures and the COVID actual allotment. Because it looks like they drew from the COVID funds first.
okay, okay.
Any further questions on this budget increase item? Comments? Hearing none, I'll entertain a motion.
I make a motion to approve item 2517.
Second.
Thank you. We have a motion and a second. Any further discussion or questions? Hearing none, all those in favor, please say aye.
Aye.
Opposed, say nay. Motion carries. Thank you, Amy. So going back to our spotlight on finance.
So of course, we're hitting budget time. This is when the finance spotlight comes up, just so we can have a discussion on the process of the budget, what the timeline is. This year I'm doing things a little differently. I am going to review the information that was in our 2024 annual report. I reached out to the auditor's office to get some information, to just provide some more information that wasn't, I guess, presented in the past. So this slide here is just, it's straight from our annual report. It gives the department as a whole the revenue, where it was received from, and then our expenditures. Of course, where the majority of our funds did come from contracts and grants, which do include the HFI funding, and then our expenditures, overwhelming amount spent on salary and benefits. So we'll break that down in the next few slides. So with this slide, we're going to go into more detail regarding the revenue side of the department. Levy support, that is taxes collected locally, which is then multiplied by our tax rate, which is determined by the auditor as well as the Department of Local Government and Finance down in Indianapolis. I have it broken down, the fees, what units received fees and what their amounts were, as well as the contracts and grants listed. The majority of our grants were our federal grants. We do have one state grant, that is our CHW Safety Pin Grant. Also included is the donation from the Fair Foundation for our School Health Liaison Program, as well as some miscellaneous refunds and returned checks that came back to us. So overall, we took in over $10 million in revenue for the whole department for all sources. Speaking of revenue, the impact that we're seeing from the reduction of revenue for the property transfer program, I just wanted to give a Q1 update of 2024 versus 2025 to see how we're doing. It's actually, overall, we're down about 5%, which isn't as bad as I thought it was going to be. Of course, the environmental health revenue is down 30% itself. However, other units have brought up their revenue. For instance, the immunization clinic in South Bend is up in revenue 57% over last year at this time. That I am attributing that to, we are using VaxCare for our billing. No longer are we having to pay VaxCare for vaccine that's administered. We're actually getting money back for vaccine that's being administered. So that has helped greatly. So even though the reduction overall for the department is about 5%, we are seeing that impact in environmental health from losing the ability to review and charge for those property transfers. Regarding revenue that was lost during 2024 or had ended in 2024, our Health Issues and Challenges grant that expired June 30th of 2024 with no option for renewal. The Immunization Supplemental Grant expired June 30th of 2024 with no option for renewal. And our School Health Liaison Grant expired June 30th as well with no option to renewal. However, that grant does have a healthy fund balance to be able to continue the work that has started with the school program. As mentioned, the revenue lost in 2025 is the immunization grant, around $199,000. And then the CHWs for COVID, which is the CDC grant, we lost out on over $358,000 that we were not able to use. Grant funds set to run out during this year. Our countywide lead initiative, which funds are for lead CHWs, they are already built into a HFI, so when those funds expire, we won't have to come and ask for a budget approval. They have already been built in since we are anticipating that running out. Immunization COAG grant, the $83,000 that we do have left, we do have a plan to use that fully up by June 30th. Then those staff will go to HFI. The Local Health Services Grant, which for this month in the HFI shows a $0 fund balance. That fund has been eliminated, and those staff are now being funded through the Health Trust Fund. And as Dr. Migliore mentioned, it's me being selfish and wanting to manage as few programs and funds as possible. And that's why I am going to try to eliminate, if I can pay from here instead of here, so I can close this out, and that way I don't have to do annual reports and budgets for this one and minimize what I have to do. That's my strategy in going forward with that. The CHW Safety Pin Grant, which is our only state grant, that will sunset here probably within the next month or two, and that staff is already also built into HFI. So we were expecting those other ones to sunset. We're prepared for them. It was the immunization grant that really caught us off guard. The hot topic of Senate Bill 1, I'm sure you all heard, has passed. We don't know the impact of that to us yet locally. I met with Abby Doyle this morning, who is the deputy auditor. They're waiting for final information to come through to know how that impacts St. Joe County and then us as a department as a whole. So once we have that information, we will share that. Going to the expenditure side of the department, this of course lists everything by series. So I have everything categorized that's related to salary and benefits for each fund or grant that's listed there. We are, like I mentioned before, the majority of our expenditures are under the personnel part of the budget. We do have supplies and services also. Capital, just some examples of capital expenses that we've had, because we don't have those quite often. For 1161, that is HFI, Local Public Health Services. We purchased a lot of equipment for the Vital Records Department, trying to get them paperless at their counter. It's still a work in progress. We're working with IT to get that actually up and running, as well as some equipment for our communication and event specialists to be able to create media and promote the Department of Health instead of having to contract that out to be done. For 8131, which is the immunization grant, we purchased some AEDs for our clinics as well as our mobile clinic, laptops, and some equipment for our vaccine refrigerators and freezers. For Fund 9111, which is our trust fund, which funds Vector, they got a much needed upgrade in a fogger, some safety cabinets, spreader, dust blower, just some new equipment since that program has expanded from what it was in years past. Next slide, please. This information I thought was good to have in here. It's how over the last 5 years, what was the Department of Health's certified budget, what were our actual expenditures, what was our certified levy from it's from Gateway, as well as the estimate from the auditor's office. As you notice, the certified levy amount is different than the estimate from the auditor's office, and that the explanation I got from Abby Doyle in the auditor's office is that the certified amounts do not include circuit breaker or any other deductions that could happen at the county level. Actual receipts is what we did receive in tax support, and then the last column is just our certified tax rate over the last few years, which outside of 2023, when it did go down a little, it has climbed very incrementally, but it's gone up each year. And then going on for what we're in the middle of right now, the annual budget process, Dr. Rigliori, Dr. Persholka, myself, and Mike met to give each unit a budget using HFI funds and then ask them to determine how to use those funds within their unit, particularly just for the items that are going to be funded from HFI. So we're waiting to get that information back. The deadline for them to return that is next Tuesday. So once we receive all those, we will then schedule meetings to have discussions with those units to, I guess I'll compare it to what we have to do, meet with the council and the commissioners and present, our budget and, give explanation on why they're asking for X amount in X category. Early May, you may have already gotten an email from Jenny that was on the Finance Committee. Found out today when I was talking with Abby Doyle that they're not going to put out any budget guidance until the middle of May. So I can't ask you to approve a budget without budget guidance. However, I also found out that the HFI budget is due June 1st. So instead of having all 4 on one cycle in one Finance Committee meeting and one Board of Health meeting, I will have to have 2 separate Finance Committee meetings. Early May, hope to have the HFI budget to the Finance Committee for their approval, and then the full Board of Health will approve it at their May meeting. And then early June, we will meet with the Finance Committee to discuss the other 3 budgets, and then have that final approval at the June budget or Board of Health meeting. So I hope to get everything scheduled and working well with that. And the 4 budgets that are going through this process, usually we only put through the County Health Fund, which is our main budget, which is tax supported and fee. supported. We're also going to do, of course, HFI, but then there's two other ones, the school liaison program as well as the trust fund, and I have there possibly the trust fund. We may utilize all the funding this year, however, I don't think we are, so I would rather be prepared to start January 1st. If we don't go through the budget process now, I can't start anything till January 1st, so they're already a month and a half behind the gate starting for 2026. So the auditor's office asked us to put it through the process. I think it's a great idea. That way, come January 1st, we hit the ground running with the expenditures and the grants that we have. And then, as I mentioned, the HFI budget is due June 1st to the Indiana Department of Health, and then June 30th is the deadline for the other three budgets that will be due to the county. Late July, early August, it seems to vary. We have those individual meetings that I spoke about with the Department of Health going before the Select Few Commissioners Council and the Auditor's Office to present and review the proposed budgets that we will have. And I'm able to answer any questions.
Thank you, Amy. Any questions for Amy?
Sort of an unfair question, but do you, in your experience, and trying to be a budget projector, anticipate anything from the Indiana Department of Health that might offset our ability to continue our programs in terms of any shorts or cuts or anything of that nature?
Seeing as how we were down quite a few grants as it is, and the ones that are sunsetting this year, we knew they were sunsetting. I believe the House Bill 1001 has $100 million right now in it to be budgeted each year for HFI, which would be a third less than what we're getting this year. So my estimation would be, us as a county, somewhere around $4.2 million in revenue that we would receive. I have done some projections, going out how long, are we able to go with the county health fund as well as HFI. We've had some internal discussions, and that's what, we're waiting to have those meetings with the units to what is needed to run your program efficiently and successfully. And we definitely don't want to jeopardize any programs that we have in our county, especially the ones that we have done for decades and decades, the two new ones being Radon and the Ember program. Everything else we've been able to offer for decades. So I'm confident that we're going to be able to continue on with the new allotment of HFI funding if it stays at a minimum at the $100 million. If it goes less than that, I think there'll have to be some discussions.
Yeah. Good, thank you.
Any other questions or comments?
So you said that you're seeing roughly 4.2 is what you're projecting that we
Just for our county.
for HFI, as the HFI fund.
Correct, just HFI.
Are there, because I was wondering with the contracts and grants section, a lot of what you have listed, I guess I thought they were state grants and,
They get filtered through us through the State Department of Health.
okay.
They start, they're federal grants that get filtered that go to the
okay.
State Department of Health, and then the State Department of Health issues them out.
Okay. I was wondering if there are, besides HFI, what other grants do you anticipate, state grants that we've been getting, or I'm thinking state grants, but state grants where we're, applying to the state, would be available for us to apply for calendar year 2026?
The only other one that is still in the process, we did receive a request to, like a letter of intent for the Public Health Emergency Preparedness Grant, which
Oh.
that has been something that we've had for years. It is at $25,000. I believe a few meetings ago we asked for approval to apply for that grant. I haven't heard anything from state that has been eliminated or going to go away. outside of HFI and our county health fund, I believe that's going to be the only one that's going to have new revenue
Okay.
coming into it.
Okay. Any other questions? Thank you, Amy. Very nice, nice work.
Amy does a stellar job and has high regard from the auditor's office, which I think it appears to be difficult to obtain because the auditor deals with a lot of different personality types and budgets, but she has won their hearts over, so.
Yep, she's fantastic. All right, thank you. Next item is grant requests. We have none. Old business, we have none. On to public comment. Jenny, do we have anybody signed up? Oh, I better start talking. At our regular meetings, the public is invited to address the board for 3 minutes regarding items posted or not posted on the agenda. Individuals may speak only once during this section of the agenda. Speakers shall properly identify themselves by stating their name and address for the record. Personnel issues are not to be addressed during the open sessions of the Board of Health. The board president may interrupt, warn, or terminate a person's statement if the statement becomes personally directed, abusive, obscene, or inflammatory. Thank you. Dr. Heckman Davis, please.
Good evening. Cynthia Heckman Davis, my address is on the sheet. We're all waiting to see how the Indiana General Assembly sets public health funding for the next 2 years. But there are 3 worrisome amendments that I would like to bring to your attention. First, the proportion of HFI funds is changed from 60% preventive and 40% regulatory to 90% preventive and 10% regulatory. So that's going to directly impact our vector program, I believe. Second, tobacco cessation has been dropped as a core responsibility. The tobacco has been busy. Third, and worst, HFI funds are to be used only for U.S. citizens. How? And more importantly, why? The impact on TB detection and treatment alone would be devastating, but how and why are departments of health supposed to serve only citizens? This amendment tells me that our legislators remain woefully ignorant about how public health is done. Please let them know how you feel about these amendments. My other comment for today is a skeptic check regarding research. There was a headline-grabbing Cleveland Clinic study saying that there was somehow a negative effectiveness of the flu vaccine, and that those vaccinated were nearly 27% more likely to get the flu. That's stunning. I looked at some media headlines, ban the flu vaccine, get rid of the trivalent vaccine. So I looked at the actual study. It turns out the only stunning thing about it is how badly it's being misrepresented in the media. The study followed 53,000 employees of Cleveland Clinic for 25 weeks to see who got the flu. 84% of employees got vaccinated and 16% didn't. Slightly more than 2% of the much larger vaccinated group got the flu, and slightly less of the smaller unvaccinated group got the flu. The difference between the slightly more and the slightly less groups was the 26.9% being trumpeted in the media. But basically, only 2% of employees got the flu and nobody died. Nationally, about 14% of the U.S. population got the flu this past year, and over 25,000 of us died. We know that the flu vaccine works. I looked at author comments, and in fact, co-author Naveen Shrestha did not conclude that the vaccine increases risk. I'm in favor of more research on this topic, but if anything, this study shows that working with vaccinated people is a good idea. I was a little relieved to hear that RFK Jr. has backtracked and now publicly states that measles vaccination is the best way to prevent measles. I'm only a little relieved though because he's using my tax dollars to fund autism research, hoping to find by October 1st of this year confirmation of his personal opinion about the causes of autism. I'm sure that the headlines will be glaring, and I would ask all of us to remain skeptical. Thank you.
Thank you. Anybody else, Jimmy? All right. Next item on the agenda, time and place of our next regular meeting will be May 21st at 4:30 right here in the 4th floor council chambers. Next item is adjournment. We are adjourned.
Thank you.